Good afternoon and welcome to our webinar on the new course we've created and are now releasing called Legionella Essentials. My name is Ryan Church, I'm the WorkRite Sales Manager here at PostRite, and I'm flying solo today. I haven't got my Technical Director colleague Chris Jones with me today, so we'll be asking some questions later on and I will get to try and respond to all of them, but bear with me for a few moments towards the end of the presentation because I'll need to decipher those myself. But the Legionella course is the 29th title added to our enterprise package. So I'm also going to talk a little bit about the rest of the enterprise suite, as well as a quick look at our new CourseBuilder tool. We're in the final stages of testing that. So it'd be useful for you to hopefully to see how that slots in nicely with the new course and the enterprise suite of courses as well. First, though, I did want to say a big thank you to everyone for joining me today. It's been a good few months since our last WorkRite specific webinar, and I've been asked by a number of people when the next one might be, along with that age-old question of what's new. Well, since the very exciting release of our WorkRite Agile package back in March this year, all hands have been on deck presenting and evolving that course with new and existing customers. So the technical team have been involved or caught up with me on that project, which has been great success. And if you're interested in WorkRite Agile, there is a recording of that and all previous webinars on our website. Plus, anyone new to WorkRite can register as a guest to see the full course, as well as the whole enterprise suite. But today's not focused on that. Today is about the latest title we've created, Legionella Essentials. Previously, when we've released the new enterprise course, we've carried out a full read-through of the content. However, we've had mixed feedback on that method. So today, I'm going to click through every slide, but only pause on a selection of the key points. This way, we've got more time for questions at the end. And if you are looking to read through every word, you can either run back through the recording once we've published it, or register on the guest account to go through the course any time of your choosing. Just quickly, if you are an existing Access All Areas customer or an enterprise customer, and you want this Legionella course activated on your live system, please either speak to your account manager or drop our support team a line, and they'll get that done for you completely free of charge, as it's included within both of those packages. So our new Legionella Essentials course provides all the information users need to identify and mitigate Legionella risks and prevent staff from falling ill. You wouldn't have thought I read that straight from the invite for the webinar today. Okay, so the course itself, it's as I say, one of our enterprise courses, so it follows the traditional e-learning process. In our introduction, we say Legionella bacteria can cause a range of diseases in humans, including Legionnaire's disease. The bacteria can be found in low numbers in natural water sources, such as rivers, lakes, and reservoirs, but it is only when it grows and multiplies that there becomes a risk of infection. We then talk about what is Legionella. It's a disease caused by Legionella bacteria, are collectively known as Legionellosis, and I won't be trying to say that too many times in this broadcast. But with the interactivity we have here, we talk about people over 45 being more at risk, smokers and heavy drinkers being more at risk, people suffering from chronic respiratory disease, and also anyone with an impaired immune system are being higher risk factors. Where does it come from? It is present in natural water systems, but it's very rare. We'll talk about the sweet spot from a temperature perspective within the course. You don't tend to find those very often in nature. How does it spread? Go straight into talking about that 20 to 45 degrees Celsius sweet spot. The water droplets and the fact it's an airborne disease, airborne pathogen rather than actually being the water itself. Stored water and nutrients. We talk a bit about the symptoms of Legionnaire's disease, starting 2 to 10 days after exposure: headaches, muscle pain, chills, fever that may be 104 or higher. And then we go on to the further symptoms about cough, shortness of breath, chest pain, gastroenteritis, and confusion or other mental changes. We then go on to Legionella risks specifically at work. So know your systems. Now, not many of us, I would have thought, have got cooling towers, but they are a primary source of causing problems with Legionnaires. Dry, wet, and cooling systems, hot and cold water systems, and those lucky ones of us that have either got a hot tub at work, which I know is very few, or in the gyms that we have access to, either through work or through our sort of private memberships, hot tubs and spas are a source of the problem as well, or can be. Other potential risks as well, so talking about humidifiers, air washers, emergency showers, eye wash sprays, indoor ornamental fountains, and aqueous tunnel washers, etc. So we're talking about making people aware of the particular pitfalls. We've created a case study here. We've used NHS as an example at a hospital. We then take people through what the risks are, and rather than just preaching to people as to what they should understand, it's a case of the water hygiene consultant has identified that there may be a risk of Legionella at the hospital. What is the risk? So if I got it right, it phrases me, that's right, stored water was regularly reaching temperatures of between 20 and 45 degrees, which is ideal conditions for Legionella bacteria to grow. However, if I'd have got that question wrong, just going back a screen, it's a case of that's not quite right, and then gives me the correct information. So it's a different way of ensuring the information is communicated to the user. So your responsibilities: an employer or person in control of the premises, you are responsible for health and safety and need to take the right precautions to reduce the risk of Legionella. You must understand how to identify and assess your risk, assess sources of risk, manage any risks, prevent or control any risks, keep and maintain the correct records, and carry out any other duties you may have. We go on to talk about identify and assess sources of risk. What are the risks? Again, going back to this 20 to 45 degrees. Risk assessment, your risk assessment should include, we've given bullet points there as to what the risk assessment should include. Even if you're at low risk, you do not need to take any further actions at this stage. Any existing controls must be maintained and the assessment reviewed regularly in case anything changes in your system. Talks about competent person, and a lot of this content is drawn specifically from the HSE detail, but the health and safety executive states that an employer or person in control of premises must appoint one or more competent people to help you meet your health and safety duties and to take responsibility for controlling any identified risk from exposure to Legionella bacteria. So we talk about contractors. Before you employ a specialist contractor, you must be sure that they can do the work required to a high enough standard. It is still the responsibility of the competent person to ensure that the work is carried out to the required standards. So we go back to our case study, back at the NHS, and we talk about, in this case study, who is the responsible person? Is it your health and safety officer? Not in this case. We find out that it's actually the Legionella and water hygiene consultant. We then start talking about prevention and control. So first, you should try to prevent the risk of Legionella by looking at the type of water systems you need. And we talk about the ways of doing that. So develop a schematic diagram of your system to help you understand it. Identify who is responsible. Ensure the safe and correct operation of your system. Be aware of what control methods and precautions you will be using. And know what checks will be carried out, how often will they be carried out, and ensure the controls remain effective. In addition, you should think about these extra bullet points and then keeping records. I mean, if you have 5 or more employees, you must keep records. If you have less than 5 employees, you do not need to keep records, although it is recommended to do so. So standard HSE wording that we've included there. Finish off the case study. So how long should NHS Trust keep results of monitoring, inspections, tests and checks carried out provided by the Legionella and water hygiene consultants? 4 options. If I was to get it wrong, that's not quite right. Most records should be kept for at least 2 years. However, all records of monitoring, inspections, checks and tests carried out should be kept for at least 5 years. So you can see it's a good way of getting across awareness information for the essentials of Legionella. In summary, we've got 2 slides, and I've mentioned at the start, you may not be an organisation that has cooling towers either near or part of your organisation. So you may want to be editing parts of this content either at the point we implement the course or some point later down the line, because maybe your summary or the information you want to communicate has changed at some point. So I'm going to show you in a moment or two how I can make some slight changes or even major changes to this course or any other enterprise course using the CourseBuilder tool. So there's my summary. I then carry out a test to prove my understanding of that content. Again, as with all of our tests, it's a are multiple choice options. The order of the questions are changed each time the person logs into the course. I won't put myself under the undue pressure of completing that test with everybody listening, but you are welcome to go through that course in detail on the guest account and answer the test and see if it fits with what you're looking for. I'll come back to a little bit onto the course in a moment, but where Legionella fits in nicely with the rest of our enterprise package, we've got 29 now courses that are included in enterprise, and they include anti-bribery, anti-corruption, anti-money laundering, asbestos awareness, AssessRite 3.0, which is a newer version of the AssessRite course, conflict resolution, COSH awareness, Data Protection Act, driver awareness, environmental awareness, equality and diversity, FeelRite, which is our stress awareness package, FireRite, which is our fire awareness package, First Aid Refresher. This is a course that a lot of our access all areas and enterprise customers aren't always aware that is available. The First Aid Refresher course is delivering the same theory content that is delivered to first aiders in their annual half-day refresher. So it's a good opportunity if you're not currently sending your first aiders on the annual First Aid Refresher. It's a good point of getting the information across to them. Food Safety Level 1, Food Safety Level 2 Catering and Level 2 Retail. Then go on to GDPR course, so again, including more of the HR titles. HandleRite is our manual handling course. Home Workers is a DSE specific course for home workers. We've covered Legionella. MobileRite is our mobile workers course. NEM, that stands for New and Expectant Mothers. OSA and OSA LM, that's Office Health and Safety Awareness and Office Health and Safety Awareness for line managers. You then have Personal Travel Safety, Risk Assessment course, Safeguarding, Slips, Trips and Falls, Working from Heights, and then we can also host SCORM courses within the WorkRite platform. So if you've got alternative courses hosted elsewhere that you know are SCORM, written in SCORM format, they could also be hosted on WorkRite as well. So I just wanted to sort of skim through all of those titles because it's not always apparent at the point of taking on one or more courses with us how expansive our enterprise suite is, and all of those courses are included in our enterprise or access all areas options. So I mentioned about editing courses. This is a tool that we are in the final stages of testing at the moment. It's a CourseBuilder tool specifically designed to create and edit WorkRite courses. So what I mean by that, this is actually the tool that we use when customers give us information or give us content to edit their courses. This is the tool that we use to build our courses from scratch. And we're just finishing off the final testing to make it completely, I say usable is the wrong word, but intuitive and effective for all administrators and authors. So that's the word I'm looking for. All authors within a company's organization. At the moment, you can build a course, you can create the content, you can edit the illustrations, but at the moment we have to put your tests and assessments on the end of a course for you. But as soon as that testing is completed our end, we will include that functionality within the CourseBuilder tool. So what I've done here is I've gone to my course building tool, I've picked on the Legionella Essentials course, and I've decided that I want to edit the previously published version, which is the 11th of October. So as an author, I would select the course, decide which part of the course I wanted to edit. So in this example, I'm just going to edit part of the summary. And I mentioned this slide here. So if I wanted to edit the content here, using the CourseBuilder tool, simply edit the content. Okay, edited for demo. Close that screen, and you can see straight away here, edited for demo is in my version of the course that's in front of me. That's not published to the rest of the organization just yet. But if I was to save my changes, that change will take effect immediately. But I can also change background images. So if you didn't want to have, in this example, your power stations in the background, I can then go into my image selection and let's pick something random from one of the other courses. If I wanted to pick I had an image to hand, it's a little bit different. Pick that image there. If I close that, now. Okay, you need to do some stretching of the image. I mean, that's stretched across the whole of the back of that image because it was previously a half screen image, but you can see that that background image has changed straight away using the course building tool. And you could be using your own pictures, illustrations, videos, audio recordings within the WorkRite course building framework. So it's a very effective and flexible tool that enables you to make changes to your courses if you wanted to. But if you wanted us to be making those edits, as we have done previously with customers, that's something we can still do as well, and you wouldn't then need the course building tool as well. So a bit of a whistle-stop tour through the course, the enterprise package. If anybody's got any questions they would like to ask, could you put them through and just type them into the screen now? I'm going to see if I can do two things at once, and I sometimes struggle with two things at once. Okay. First question, how much is the course builder? Okay. The course builder tool is it starts at £2,000 a year. If a customer only needed to use it for making small edits, potentially that course builder only needs to be live for a 1 year period or a short period. But having it active annually, it's a £2,000 a year starting point for that product. Any other questions at all? Is the Legionella course accredited, and if so, who by? Okay, not currently. The Legionella course isn't currently approved by either ROSPA or CAH, and it doesn't currently have CPD points, but it will do. We're securing all of those for we're securing that for the Legionella course, and we are reaffirming all of those for our whole suite of enterprise courses as well. So that is due in the new year. Any other questions at all, folks? Okay. It's not been asked, but I'm going to just show you this very quickly. Okay, so this is how we package our e-learning now. It's a way of simplifying things for customers, and it makes things much simpler for our internal team as well. So if you were just looking for the Legionella course itself, it's one enterprise course, so it would fit into our basic package. If you wanted access to all of the courses, that's enterprise. You then have the WorkRite Agile course, which was detailed in a previous webinar back in April time. Please go back and have a look at that if you've got any interest at all. But that's packaged as Agile. That's simply the WorkRite Agile course. And if you did want everything, so the Agile course and the 29 enterprise courses, so in effect 30 courses, we would be calling that Agile Enterprise. Now it's these four packages here. We've got a lot more scope for economy of scale and packaging those with particularly existing customers and people that are looking for larger volumes, quite significant discounts there, particularly before the end of the year. But if you wanted to have something bespoke, maybe a combination of a couple of enterprise courses or our accident management system and the course builder, we would be branding that enterprise bespoke, but it's something that your account manager can talk to you about in more detail. And if I just escape from that. There we go. There we go. There are the contact points for you to be either registering on a guest account to get us full access to all of our courses. Our support contact number there as well. If you, as I said earlier, if you're an existing customer of Access All Areas or Enterprise, the Legionella course is now live. It's available. Please just let your account manager or support know that you want it activated. It doesn't have to be live for all of your staff from day one. You can have it activated for just yourself or a group of people to review. As I say, let support your account manager know, and we will activate that for you completely within the price you're currently paying. But for new customers, if you have got any interest in our courses, this is where you need to go to. So the postrite.co.uk/WorkRite address, and then click on free trial, and you have full access to all of our courses. There's no more questions, so I'm going to thank you once again for joining me this afternoon. Appreciate your time, and if you've got any further questions regarding the course, the packaging, next courses that are coming up, anything of any interest, do let us know. We're always keen to hear your thoughts and any feedback, both on the content, the delivery, and anything else we can help with. Thanks very much for your time, folks. Good afternoon.